Hello everyone, my name is Melinda St. Louis and I'm the campaign director for Public Citizen's Medicare for All campaign. Since our founding, Public Citizen has advocated alongside organizations like Physicians for a National Health Program, PNHP, for single-payer health care. And we're thrilled right now to be working with all of you in this current political moment, where expanded and improved Medicare for All is really a mainstream policy idea that we're all working to build support for. My colleague Brittany and I will be talking to you about an exciting campaign that PNHP, Public Citizen, National Nurses United, and many other national organizations have jointly launched to mobilize activists from coast to coast and local government officials to win hundreds of local resolutions supporting Medicare for All in cities, towns, counties, hamlets, all over the country. In order to powerfully declare that healthcare is a human right and that everyone should have access to the healthcare they need. We've launched this nationwide effort to build support for Medicare for All at the community level because local governments really have an important role to play in highlighting the desperate need for expanded and improved Medicare for All. Local governments are on the front lines. They understand all too well the consequences of our unaffordable and inequitable health insurance system. Municipal budgets are increasingly strapped. As health insurance premiums rise, local businesses are struggling to make ends meet due to rising health costs, and local governments often are the ones providing frontline response when community members face medical debt, or if they have to go to the emergency room or become gravely ill because they lacked adequate health insurance. So by passing local resolutions, local governments can help shape the national public narrative and build political will that we ultimately will need to win guaranteed health care for everyone as a matter of right. This is a great tactic because it's relevant everywhere. It's in red states and blue states and big cities and small towns, districts where members have already co-sponsored, districts where your members may be hostile to the idea currently, and it gives an opportunity for local activists to build power at the local level and to generate earned media attention in order to educate the public and to win important victories along the way. So, and importantly, as you think about how you're going to develop a relationship with your local officials, with your state officials, and federal elected officials, winning a local resolution is a really great tactic that you can use to pressure the state and federal local electeds to co-sponsor, to hold hearings, and to ultimately move to pass the legislation. And it can be localized to support relevant state initiatives that you might be supporting. City council members, county commissioners, mayors, they can have significant influence over members of Congress, and they've often been an untapped resource for advocacy. And many legislators who are resistant to Medicare for All tell us that they haven't heard enough from their support in their districts. So a local resolution really shows otherwise. And these, as I mentioned, these local resolutions are a great organizing tool to help you build your coalition and to build power. So we will be talking to you about a new website, MedicareForAllResolutions.org, that has a toolkit and all the resources that you need. My colleague Brittany, who's our main organizer for this campaign, is going to share a bit about the tools and resources that are available to you to help you develop relationships with your local officials and use these resolutions as advocacy in your federal advocacy as well. So I'll turn it over to Brittany.
Hi. So in terms of resolutions passed already, I think one of the most exciting ones we had recently was in Cook County. That was covering the city of Chicago, the second largest county in the country. We've had St. Petersburg, but we're also having small towns like Norristown, Pennsylvania is coming up soon. So it's a mix of counties, cities, and towns. And so I wanted to talk to you about how to find or start a resolution in your town using the tools we have on our website, which is Medicare allresolutions.org. So this is a difficult to zero in on map that you can find on our website, MedicareForAllResolutions.org. And when you go and look at the map, you can find your town or county or a city near you and use it to sign up to a local effort. You can also use the map to look up cities that have passed resolutions and to read the text of the resolution so that that can help you to write what you're planning for your own municipal government. So you can use the map to find an effort, or you can click a link at the top to start a new one. And you can also watch a previous webinar. We have had a number of webinars on our online across the country featuring activists, city council members, mayors, Congress people talking about this effort. And you can watch previous webinars on our website, or you can come and join us for the next one. You can also plan an organizing party to get started. Maybe you feel like you want to pass a resolution and work on it, but there's not enough people around, or maybe you know some people and you want to get them together. We can help you plan for that, and there's also a toolkit on our website that will help you plan for an organizing party. The next step that I wanted to talk about is how you build a relationship with a council member to get them to introduce your resolution. One way to do this is to have a constituent meeting. If you have a friendly council member that you already know, or who will meet with you because you're in their district, you can set up a meeting with them or their staff to talk to them about Medicare for All and feel out how they might fit into this. You can also, if you have had difficulty getting a meeting, you can also kind of show up. You can show up when they have a public appearance somewhere to open a bank or a family center, and they usually say where they're going to be on Twitter, and you can use Twitter to constructively stalk your local council member so that they know who you are, and they'll be much more likely to meet with you and be friendly to you. You also need to be persistent in setting up your meeting, because the staff of a council member are very busy, they're conflicting multiple priorities, and you want to remind them that you're there and that your issue is important. Don't worry about badgering them. This is how this stuff gets done. You can use our toolkit on the website to prepare the meeting, to prepare handouts and statistics and ideas for how to talk to your council member about Medicare for All. Now moving on to passing a resolution. When your council member has decided that they are ready to work with you to introduce your resolution, you can discuss a timeline and strategy with them for getting it passed, so that you know how many weeks you have until it's introduced and how you can organize for that. You can use the toolkit on our website, as well as the past resolutions I mentioned before on the map, to write the resolution. Often city council members will just take the resolution you've written for them. Sometimes they like you to add information that is specific to your local area. And then let us know that there's a resolution underway. So you can contact me, Shannahan at citizen.org, or you can just contact us through the website. So you want to inform your local organizations that are friendly and a part of this effort. Our coalition members include Progressive Democrats, Democratic Socialists of America, National Nurses United, and Physicians for a National Health Program, and many other groups like Our Revolution. It goes on and on. So let them know, if you know people who are interested in organizing on Medicare for All in the area, let them know that there's a vote coming up. Another thing that to plan for is the social media and outreach arm, because we want the rest of the country to be able to see that your town is taking a leadership role in this movement. You can also use our campaign and our staff to produce to do some phone banking and make phone calls to people in your city who live nearby, and to get out the vote, to get them to call their council member to influence the vote in our favor. We'll also help you get ready for press, and we do have some press toolkits on our website. We also have some really great toolkits on preparing a testimony to deliver to your city council. Many city council meetings are also live streamed, and that makes for another great social media opportunity. Now, once your resolution has been passed, once we've gotten through there, there's just a few more steps. You want to share the you want to get this resolution to your federal representatives and senators, right? You want them to know that you are on the map. And one way to do this is to get the council members who have been supportive, or mayors who have been supportive, county commissioners have been supportive, to write a letter to your legislator asking them to support Medicare for All, informing them of this decision. Many representatives are themselves former council members. And another way to do this is to take the resolution to a constituent meeting in their district when your rep is visiting their district, or if you're going to DC or you know someone who's going to DC, they can take it with them. Finally, we want to use your victory to continue to build momentum on the resolutions campaign. We want you to share your experience with us to help us train other local leaders who want to pass a resolution. Another thing you can do to keep everything going in the right direction is to bring this effort to a neighboring town or county in your district to share your experience and your skills and your knowledge to continue building pressure on your representative or senator.
Thanks, Brittany. I'm super excited about this initiative and this campaign. And in just a couple of months, we have just been really inspired by all of the activism that we've seen from people all over the country. As we mentioned on that map, we already have over 150 efforts underway in small towns and in big cities. And we've also been hearing both from seasoned activists, people who've been doing this work for a long time, and from people who this is the first time they're really getting involved in healthcare advocacy. And what we're seeing is that this is a really approachable and empowering way to get involved, to start to build these relationships. Local officials, they are in your community. They are members of the community, and it's a great opportunity to begin to have those dialogues, and then to use that, as we mentioned, to build toward advocacy with your congressional representatives and your senators and more. So we really look forward to working with all of you to build this movement together. We've already come so far to have Medicare for All in the national dialogue the way that it is. We really feel like this is within reach. The opposition is mobilizing, so we have to really be strategic, and we have to and do all of the work from the ground up to make the case for Medicare for All, to educate our neighbors, to educate our local officials and our representatives, so that we can really make this a reality for everyone. So thanks so much for listening, and we really look forward to working with you. Go to www.medicareforallresolutions.org, and we'll look forward to connecting with you. Thanks so much.
Thanks.
Hi there, my name is Wynn, and I've worked in health policy and advocacy on vaccine promotion, health outreach, immigrant health, HIV/AIDS, LGBTQ health, and now single payer for a few years now. In this work, I've had to do a fair amount of regular lobbying and relationship building in my community, among other organizations and coalitions, and with local, state, and sometimes federal elected officials. Now here in New York, we are lucky to have some great health champions in many of our local and state elected officials, including on single payer. But like all relationships, it takes time, patience, diligence, respect, and creativity to really make those lasting connections. Some of my best relationships took several months to a year to develop, especially as I was also becoming more comfortable as an advocate, and as these elected officials and their staff were becoming more comfortable and knowledgeable on the issues I and other advocates cared about. Medicare for All is a complicated subject to many individuals and to elected officials, especially with moneyed interests making some really nonsensical misinformation spread, and with the confusion that our healthcare system can inspire in many. But elected officials and their staff are human too. It's important to remember that they must work for the interest of all their constituents, not just a few, And many will be sympathetic to and even become partners on the issues you want them to fight for. Just think it takes some thought and some good relationship building. A few things I was taught to consider in making these connections was to, one, choose your targets. Now, are you looking for to influence your personal congressperson, council member, state senator, representative, etc.? Are you trying to get a health committee chair to become a champion of your cause? Are you trying to get a representative of the community you serve to help that community you serve? Are you trying to persuade a local majority leader to bring a piece of legislation to a vote? Uh, all of these considerations and more are important in deciding who your target is and will help influence how you build that relationship. I don't have time to go into this on this webinar, but for more, I would look into power building frameworks that can really help you understand the influence that an elected official has in the spheres, the communities, the issues that you want to work on, and can be a really critical tool for relationship building. Second, make contact. I know advocacy is scary, and sometimes working with and getting to know your elected official can be a little bit nerve-wracking, but you won't actually build up a relationship without actually making a first contact. Now, I believe that everyone has it in them to become incredible advocates. You don't need to be a policy analyst like I have been. You don't need to have a full policy team or endless resources to become actively engaged in advocacy. Your professional experiences in healthcare and your personal experiences of health will make you invaluable to elected officials. Adding your voice makes us all stronger, and there are baby steps to making your voice heard. Writing your target an email, sending a postcard, giving them a call, tweeting them on the Twitter. But especially if you want them to get to know your face and your voice and build up a connection with you, you need to start working your way up to making an appointment, to scheduling a meeting. You don't need to make meetings on your own. Larger groups like PNHP, National Nurses United, the Protecting Immigrant Families Campaign, and more have many opportunities for you to get involved as part of a coalition. So let's talk a little bit about scheduling that meeting. When scheduling a meeting, consider their schedules too. Maybe elected officials are in their districts during congressional recess. That's a good time to try and schedule with them. You can find their contact for scheduling on their emails or give them a call, and the office will give you information on how to schedule. And considering those timelines, for instance, New York, legislative and budget session is only a half year long, so the second half of the year becomes a really good time to get a local meeting. During state session, elected officials in New York have certain times when they're focusing on budget meetings, so a legislative meeting may be delayed until they finish those budget meetings. So being respectful about meetings taking time to schedule while also checking in regularly to try and get that meeting. The patience and diligence you show in getting that meeting will be worth the wait. Now you have your meeting. It's time to get ready to make a great first impression. How do you do that? Research your targets. What committees does your legislator serve on? What kinds of legislation have they introduced? What are the types of issue areas they seem passionate about? Even where did they go to college? It's similar to getting to know that new person you think would be a really cool friend or a possible employer you hope to get your dream job with. Any data that builds a connection to you or your issues is valuable and is going to be really, really important in making that contact critical and grow into something that's really a relationship. Be prepared. Now, you don't need to know all of the answers, but be prepared about your ask and some key facts on the situation that you're trying to change. Elected officials and their staff are generally generalists. Sure, they may know housing pretty well, specifically, or they may be a health committee chair, but you, physicians, public health professionals, nurse practitioners, health advocates, you have personal and professional stories that can make you teachers, partners, and critical experts for policymakers. Now, create an agenda for your meeting. You don't want to have too many items, maybe 2 to 3 asks tops. But some good basic items are a round of intros, stating why you're there, talking about why you're making your ask, so statistics about the issue plus some personal stories, and restate the ask. Be prepared to do this in a set amount of time. Most of the time, elected officials and their staff don't have more than 30 minutes, and they may have even less time if a meeting's running over or if something is going on, really. So practice how to say what you need to say in a set amount of time. They'll appreciate you for running a tight meeting. You'll be better prepared for those times that you really don't have that much time to speak to an elected official. I have had an hour, I've had 30 minutes, I've had 15 minutes, and I've had 2 minutes. As you get more prepared and more experience in scheduling and getting meetings, you'll get a better sense for how to tighten to those times that you need, but be prepared to try and do it in a set amount of time from the get-go. Determine who's going to take what roles: facilitator, note taker, who sets up the landscape of the problem, who can provide a personal story, who gives the ask. Bring information that's useful, so one-pagers, or one-page descriptions of your issues and your ask are important items to bring to a meeting, for instance. And now you're ready. Go execute your meeting. Go make that great first impression. Debrief afterwards on that first meeting and send a follow-up and a thank you note to your elected official. Any questions that they had that you weren't able to answer, follow up with them. And keep in touch. Give them updates. We have, here in New York, when I was working on a city council resolution, and once we had passed that resolution, I also kept some of those legislators up to date on when we were able to have our first ever joint hearings on the New York Health Act, which is New York State's state level single payer bill. And those elected officials were excited and have continued to talk to us in many cases about the New York Health Act and about single payer, even though it wasn't necessarily quite their immediate priority. They still had built that relationship up with us. The people that elected officials continue to hear from, especially if given respect and good information, are the people that they'll go to on those buckets of issues like healthcare, immigration, and more. In your interactions, here's a few tips that I would say about making sure that you're continuing to build a good relationship. If you're asked something you do not know in the moment, do not make it up on the go. Don't try to fudge it. Instead, always answer with, "I'm not quite sure. I can follow up with you." That's a statement that has really, really helped me out in my work. It gives you the chance to continue to communicate with them and solidifies that they can trust you to give accurate information. It's sometimes your word that really helps contribute to the bank of information that they know, and they need to be able to rely on accurate information. Show staff the same level of respect and interest you would the elected official. I cannot stress this enough. Staff members have been such critical allies for me. I may not know the elected officials quite as well as I know the staff, but if I know the staff, I can really, really work with the elected official. Schedulers, for instance, hold the key to elected officials' schedules. If you need to make meetings with your elected officials, you will likely need to talk to their scheduler regularly, especially if you're trying to be dogged about getting that meeting. And as schedulers get to know you better, having a good relationship helps you get their help in setting up those connections. Every time I email or call for a scheduling appointment with schedulers, I make sure to ask them how they're doing, to wish them well during busy seasons, to be friendly. And as I've built up that rapport with schedulers, they were easier to get in touch with, to get meetings. They were able to connect me with other staff to help me get what I needed, like a press quote or a policy question. And my life in advocacy became much easier. In actual meetings, you may not always get the elected official. You may get their chief of staff or their policy director or maybe an intern. Earlier this year, on 3 different state lobby days within about 3.5 weeks of each other, I was scheduled to meet with the same elected official's office all 3 of those days, and I kept on meeting with that same intern, with the same staff intern, and that can happen as capacity gets tighter on a meeting. The first time I met this girl, it was actually her first day on the job. However, I sympathize with this woman on my own experience of getting thrown into meetings my first day of work. And over the course of those 3 lobby days, it became a little bit of a joke for us to keep on running into each other. And she was an intern who was able to get me the information that I needed, and able to make sure that the information I needed to get to the elected official got to the right people to get that elected official on board with our asks. Staff have the ear of their elected officials, and officials can be rather close with their staff. You treat everyone with dignity and respect, and they can help you get what you need done. Get creative about building relationships. For me, I realized over the last year that a fair number of like-minded friends and acquaintances from college have, 5 years later, become communications and policy directors at local assembly members and state senators' offices in New York. I started reaching out and asking if they had time to catch up, to get coffee or a drink, and was respectful when dealing with clashing schedules, and finally getting those times to sit down and have a conversation and catch up. And in some key ways, the patience and forwardness helped. Some of those contacts became friends I could go to for press quotes, who come to me for questions on health policy, and are really good friends that I love being around and working with. Best story about that is one of my now best friends happens to be a college acquaintance who I realized last year staffs a pretty prominent single-payer champion here in New York. I reached out to catch up with her, and it was a really strong working relationship and friendship that helped me both build relationships with the entire office and her boss, but also gave me an ally and friend I really value. There are other ways. Last year, some coalition partners and I were working for months on getting a city council resolution passed on single payer. And one colleague happened to live in the same building as the head of the city council, and would start striking up conversations on single payer every time they were near each other outside the building, every time they ran into each other outside the building. You'll find your own way to build that relationship, but I encourage you to get creative in how you approach it, and continue to interact. There are plenty of ways to interact with elected officials and staff, from scheduling meetings to tweeting them to asking them their views on your issues at their campaign events, to attending their community events and saying a quick hello and passing off a flyer or an update when you see them. While you don't want to poke them every day, use your best judgment and be creative, dogged, and respectful. They'll appreciate it, and ideally will start to see you as someone they want to have a relationship with too. I hope this helps. Feel free to ping me at Winn, Winn Periyasamy, Periyasamy @gmail.com. I'd be happy to talk further about some more ways to build relationships with elected officials. And good luck. You have so much to offer that your elected officials need to hear in building this movement towards single payer, towards health justice, and more. I'm looking forward to seeing all that you achieve.
Our local chapter of SNAP, in collaboration with the Campaign for New York Health, other SNAP chapters in New York State, and various other groups like the New York State Nurses Association, have all worked tirelessly to garner support for the New York Health Act. We advocated not only in our state legislature, but in communities to get people on board with the idea of having a statewide, globally funded healthcare system. We're doing this because we recognize that getting a statewide universal healthcare system passed is a lot easier at this time than getting a national system passed. And we think that getting it passed at the statewide level will serve as a model for the rest of the country to follow suit. On a local level, we've been working by going to festivals and events. I myself, as well as local leaders Ursula Razum and Dr. Sunny Aslam, have spoken at churches, and we've held public hearings and forums. In terms of lobbying, We participated in the Campaign for New York's Health Apple a Day Challenge, where we visited local legislators and gave them baskets with apples with healthcare denial stories from their constituents. On a statewide level, the New York SNAP chapters worked together to get more signatures for the $10,000 for New York Health petition. We've also been submitting op-eds to local papers. Most notably, Columbia and Cornell students had a letter published in response to the CEO of the New York Presbyterian Hospitals in the Business Insider. We also all went together to Albany on 2 occasions. The first was this past April, where doctors and medical students in SNAP and PNHP and residents went to lobby in support of the New York Health Act. Then again in May, SNAP, PNHP, the Campaign for New York Health, and all other supporters of the New York Health Act and the New York Nurses Association and many other groups, we all went together down to Albany and held a public hearing. And there were so many people that shared their stories and testified that everyone was not allowed to speak, and it lasted until the evening hours. This led to the current resolution to hold public hearings around the state, so that's what we're currently working on right now. From here, we have nowhere to go but upwards. We are not that many state senators away from having a majority support, and in the upcoming year, we will work together as a state again to get these final state senators on board and get the New York Health Act passed.
Hello, everyone. My name is Stephanie Kang, and I am the Health Policy Fellow for Congresswoman Pramila Jayapal. I had found this fellowship through the Congressional Progressive Caucus Center, which was created basically after witnessing the incredible momentum we saw in the 2018 midterms and the progressive movement and the potential for us to be able to leverage progressive power in a way that had never been done before. And so the co-chair of the Progressive Caucus, Congresswoman Pramila Jayapal, along with Congressman Mark Pocan, they had this idea to ensure that we were able to really leverage the power both inside and outside the House to push forth important progressive policies like Medicare for All. And as you guys know, Medicare for All is a top priority of Congresswoman Pramila Jayapal, and as her health policy fellow, this is something that I get to dedicate an incredible amount of time to. And in my background, I actually have more of an international health systems focus and global health training, along with grassroots organizing. So I've really been able to use these skills to make sure that this isn't just about what's happening inside Congress, but really maintaining that momentum and the incredible grassroots power that a lot of you are involved in. And when Congresswoman Pramila Jayapal took on the bill, she thought it was really important to gather a coalition of key stakeholders: physicians, nurses, disability rights groups, labor unions, business owners, you name it, anyone who could be affected by this bill. She wanted to bring them together and bring them to the table so that we could create a comprehensive Medicare for All single-payer proposal. And that's exactly what we've done. We've created the most comprehensive bill to date that provides a real, serious policy outline of how we can transform our healthcare system to serve patients and not profits. And since the bill was introduced in February, I've bared witness to the incredible momentum in the House that's just been catapulted by, both Congresswoman Pramila Jayapal's leadership, but also the unprecedented grassroots momentum that is behind this bill. I know a lot of you have been in the fight for single-payer healthcare for years, if not decades. But what we've seen in a matter of only a few short years, we've seen the conversation not just around healthcare, but around, and not just around, healthcare as a human right, but, can we have a system that is the most equitable and achieves the highest level of equity and justice, and what we've seen is that that's really only through Medicare for All. So I've had the privilege of working very closely with a lot of different organizations such as PNHP and SNAP, And I've been able to be involved with some of their really important work, such as the AMA Action Week, and different opportunities. And through this, we've been able to create a very informed movement, also inside the House. When members are curious about the policy and want to be able to have resources, our office, as well as a lot of your members, have just been really there and stepped up to make sure that these offices have the best material and the best education possible on Medicare for All. And throughout that process, we've seen just this Congress, we've had 3 historical hearings on the bill. And so what this really tells us is that this bill is being taken very seriously. This is serious policy. We had the first hearing in the Rules Committee, which was just really remarkable and incredible, as well as the budget hearing on the considerations for design choices in single payer, to the Ways and Means hearing, one of the most powerful committees in the House with direct jurisdiction on health policy, have the debate of what Medicare for All would mean for the American people. And we've also garnered incredible support across the members with 118 co-sponsors, nearly half the Democratic caucus. And we've all worked so hard to be here. And, I've worked, like I said, in global health for many years. And I thought I knew the definition of hard work, but my goodness, people on the Hill, as well as Medicare for All advocates, this is just a whole another level of just commitment and dedication to the work. And, every day I have different members from PNHP or SNAP reach out, just curious and hungry and wanting to learn more about how they can be involved. So I think some of the things that I can think about in terms of making sure that you're the most well-equipped to be able to advocate for the policy is just making sure that you're up to date, right? You're up to date on exactly what the policy provisions are. The differences between the different healthcare reform bills that are out there, and that you also know legislatively in the process what's going on, right? So where we are in terms of co-sponsors, which offices have signed on. And so this is really important because, when you're speaking on behalf of Medicare for All, you're acting as a representative and on behalf of this movement. And we want to make sure that, we're seen as serious, and that we really understand the complexities of the policy and also the politics. And so I would just encourage everyone to make sure, we can reach out to our office as a resource. We'd be happy to answer any questions that you have. And also, you have many members within your own organizations, as well as other organizations such as Public Citizen, who have really great educational materials just to make sure that you have different talking points down and that you know how to speak well on the different parts of the bill. Especially because Medicare for All is like we said, it's a comprehensive bill, right? This is serious policy, serious 120-something page policy. And with that comes a lot of questions. And, people in this country are aching for change, right? This is a top presidential priority. It's on top of the ballot for a lot of people in terms of their concerns. And Medicare for All is just gaining more and more support. And so it's more important than ever that we, address and dispel any of the misinformation out there about Medicare for All in a way that is understandable and digestible and is explained very clearly in terms of the benefits of Medicare for All and what it really means for people. Right, so we have to make sure that we're engaging with the public, that we're, disseminating education in a way that is comprehensible. And, a huge part of this is really making sure that we are united, right? So as a progressive movement, we have more representation than ever. And with that comes a lot of responsibility and a lot of reasons to make sure that we understand our values and that we stay united in this time when we're pushing forth, very ambitious proposals, right? Ambitious in the sense of we understand that there is going to be incredible opposition from the other side, and also from industry. And, we have enough opposing forces towards something like Medicare for All. So as a progressive movement, and also as advocates for Medicare for All, we all need to stand together in terms of what we're trying to achieve here, and what we're trying to achieve is a system that that understands that everyone, right, regardless of income, regardless of socioeconomic status, regardless of zip code, regardless of your situation, has guaranteed healthcare, guaranteed high quality, affordable healthcare. And so, and we believe that is through a single payer system. We understand that we can't leave profit motivated industries to be determining the health care of anyone. And so that's why we have to make sure that we all agree with, and we all agree with making sure that we're achieving this highest standard of equity through our health system. And what I would also encourage people is to make sure that you really hone in your ability to communicate your story, right? So, what we're seeing now is that there's a lot of people who are very affected by the healthcare system every single day, right? The American people every day, families, employers, employees, patients, see the horrors of our healthcare system that leaves so many people unable to access care and leaving them sicker and having to make impossible choices between paying for their mortgage or paying for their insulin. And so, these stories have to be captured, they have to be amplified, and they have to be conveyed. And so, just working on those kinds of skills, those communication skills that can really help deliver your narrative. I mean, of course, we're talking about serious policy, but we cannot forget the human element behind all of this, that we're literally talking about lives here. We're not just talking about what is the most policy or politically sensible thing to do. And so when we have that reminder, I think that these stories can be incredibly powerful. And, it's really important that all of your members and all of you, in staying engaged, just remember that, because this is not going to be an easy fight. This is going to be one of the biggest fights of our generation. And we have to be able to remind ourselves why we're doing this, right? And I think that's going to be through making sure that we stay in check and we stay connected to what is the reality of our healthcare system, what is the reality of one of the most inequitable healthcare systems that exist in this world. And so I think once we recognize that we can make sure that we lift each other's stories and that we get those important narratives out there. I think too, the incredible work that you guys are doing in terms of the grassroots, as medical students, as future generation of providers who really are going to be able to shape what is happening. I mean, you guys have already made an incredible amount of momentum already, incredible amount of movement already. And I think we just have to keep it going, keep that pressure going, and making sure that also we diversify our relationships, right? So, while physicians are, of course, very important and a critical part of our healthcare systems, there's just this huge spectrum of providers out there that we need to be engaging with, that we need to capture their stories, and making sure that this health system is, using and able to deploy a comprehensive set of services necessary for somebody to be healthy and to live a life of dignity. So, I would just really encourage that when we're thinking about these relationships that we need to build, that we go beyond just what's the traditional or typical clinical provider, the physician or nurse, but we're also thinking about physical therapists, and we're also thinking about occupational therapists, and we're thinking about speech pathologists, and we're thinking about all the different people that we need in order for people to have just a full life of health. And when we build those relationships, just really recognizing what brings us together and remembering that, and personal interests and not being distracted by what the industry is trying to convince the public of, and remembering and staying focused on why this fight is so important. So I just want to say that we're all in this together. Us on the Hill and staffers within these offices who are pushing for Medicare for all, as well as all of you, right? All of you who are on the ground, making sure that we can maintain this momentum and create really powerful potential for change. And so I just want to say, please stay in touch, and also just feel free to reach out whenever you guys have questions. We are allies in this together, and the better that we can ensure that these relationships are strong, and that we build trust and build an understanding with each other, that we both want to see real change for our healthcare system. It's going to be just so much more powerful than any of us operating alone. So keep up the incredible work that you guys are doing, and thank you so much for all the support that you also provide our office.